of Promotion and Tenure ceremony. I am Bronwyn Wilson. I'm the Senior Associate Dean for Faculty Affairs at the School of Medicine, and my team is helping to put on the celebration today. So just a couple of housekeeping things. Obviously, there are so many people that we're hoping to celebrate and give a few words. It's very, very challenging to summarize everybody's accomplishments in just a couple moments, but we have so much to celebrate. If you would please, on your if your name is not correct on the device that you're using to zoom in, if you wouldn't mind renaming yourself, because my team is going to spotlight you when it's your turn to be mentioned by your chair to talk about your accomplishments, that would be great. Otherwise, we're going to have everybody remain muted unless you're speaking. And also, we would like to record this session because others who couldn't make it today would like to see it. So we're going to be recording this session, and I just wanted to let everyone know if that would be okay. Fine. So to get us all started, it's my pleasure to introduce our Executive Vice President, Dr. Douglas Ziodonis, for his first time going through this ceremony, and I know you'll find it really inspiring.
Right. Well, thank you, Dr. Wilson. One, it's just exciting to be here in my role. I love the fact that I get to still be a faculty, and maybe not as much as I enjoyed it when I was a faculty, but through the different roles, we're all on a journey as faculty. When we come in, and the excitement and the unknown, and you never know what balance of teaching, clinical research, focus on diversity, helping others, mentoring others, working in the community, all the different fun things we get to do as faculty, and the importance of all the students we mentor and our colleagues. I would have never guessed I'd be talking to you in this role, but when I started the journey, but that's how different turns come and different opportunities. But I just want to thank all of you on this call. You are the lifeblood of the system. Without faculty, we couldn't do all the great clinical service we do and teach the students who are here, be creative in whatever way we are, whether it's NIH research or the many other ways that we can do scholarship. But I've just been thrilled to be here in my role and get to meet many of you, and I hope to over time meet all of you. But every day I get the blessing of being able to see what kind of amazing work you all are doing as faculty. I also know this isn't an easy time, and so this can be stressful too with COVID and just being a faculty and all the pressures that go on us. So I also appreciate this is a time to help each other in the stress that we're going through at times, as well as the excitement of a day like today where we get to celebrate a different type of success that we all have a common bond and club in joining. So we do want to make sure that all of you feel like you have the career development support that you need. That varies across the journey at different times in our career. So I know we have a great team here, and I can see all the smiling chairs here who are so happy when they see the success of faculty in their division, having been a chair myself. And I see all the number of the deans here and their smiling faces because they also have to support the faculty through the process. And some of you are center and division leaders also. So I'm just grateful to be able to be part of this meeting today, both in my leadership role and also as a faculty. And I want to thank everybody who put this together, and know that all the CEOs in our health system and all the leaders in our health science are so grateful for the work you do every day. So thank you. And I can also see there are a few parents and others on, and family. So thank you too, because it takes a village when you're a faculty with all the different pressures that are coming on us. So thank you.
So I think Dr. Ziodonis, if you'd like to acknowledge the Health Sciences Distinguished Professors, that would be the next part of our program.
Oh, great. Well, I don't have the list in front of me, but I'm happy to. I didn't know that was part of what I needed to do.
Oh, no, that's quite all right. We can read the names for you, and you can offer your congratulations. The first is Mary Ann Osley, Professor of Molecular Genetics and Microbiology in the School of Medicine. The next person is Nina Wallerstein, Professor of Public Health, the College of Population Health. And the third person, of course, is yourself. Congratulations. So we just wanted to make sure that we had the opportunity to recognize this great accomplishment of our distinguished professors, one of the highest honors that the University of New Mexico bestows on its professors. So congratulations. I think the next in the program is the College of Pharmacy, and we have Dr. Godwin, the Dean of the College of Pharmacy, to present our first person promoted to tenured professor. So I will turn it over to you, Dr. Godwin.
Thank you very much, Bronwyn. So I want to introduce Dr. Melanie Dodd. Dr. Dodd earned her Bachelor of Science from Purdue University in 1994, earned her Doctor of Pharmacy degree here from the University of New Mexico, and then did a pharmacy practice residency at Presbyterian. She joined the College of Pharmacy as a research assistant professor in 1998, and then in 2006, we hired her as an assistant professor of pharmacy in the clinician educator track, and she was promoted to associate in 2010. Throughout her time at UNM, Dr. Dodd has carried a significant teaching load in both the PharmD and the UNMH Pharmacy, the research assistant professor in pharmacy residency programs. Dr. Dodd has also been very involved in interprofessional education and created a geriatric interprofessional elective course in 2009. Her experiential rotations are among the most sought after amongst our Doctor of Pharmacy students. Dr. Dodd's an outstanding pharmacist clinician who practices at the UNM Hospital Senior Health Clinic, providing chronic disease management and medication management for her geriatric patients. She has received numerous awards for her clinical service from the New Mexico Society of Health Systems Pharmacists, including Pharmacist of the Year twice, and the Dorothy Dillon Memorial Lectureship. That is the highest honor for a New Mexico pharmacist, either in an inpatient or ambulatory care setting can receive. Dr. Dodd is also a productive scholar in the clinician educator track with 19 peer-reviewed publications and 3 book chapters. She's a well-known presenter at the state and national level with over 100 presentations. And then Dr. Dodd has also been extremely active in advocating for the advancement of pharmacy practice in the state of New Mexico. In 2020, she worked with a coalition of pharmacists and pharmacy students to advocate for the passage of House Bill 42, the Pharmaceutical Services Reimbursement Parity Bill, that mandates reimbursement for pharmacist-provided clinical services. At the national level, she's active with the American Society of Health Systems Pharmacists, including current service as the chair of the National House of Delegates and service on the National Board of Directors. She's been recognized as a fellow of ASHP, and in 2020 received the ASHP Distinguished Service Award. I'll conclude by saying Dr. Dodd is the epitome of an outstanding clinician, educator, faculty member, and I'm very proud and pleased that she has been promoted to full professor. Congratulations, Dr. Dodd.
Yes, congratulations. Thank you very much. And now we're going to turn it over to Dr. Christine Casper for the College of Nursing to present her candidate.
Thank you and good afternoon. It is my great honor and pleasure to present Dr. Kristen Oster-Nemowes, who has been promoted to clinical educator, associate professor. Kristen has been a fabulous faculty member. She is currently the assistant dean of undergraduate programs. She is also a certified nurse midwife and has been extremely active in the national and international midwifery organizations. She has contributed her extensive scholarship in the area of fetal ultrasound everywhere. She's an expert clinician, to say the least, who has worked at UNMH and various places in New Mexico. She has also, in recognition of her outstanding service and scholarship and clinical expertise, she's been awarded a fellowship in the American College of Nurse Midwives. So in general, she has lengthened and established the mentorship programs in the college. She has advanced the curriculum. She is a stellar teacher. And we are just thrilled to have her now as an associate professor in the College of Nursing. My biggest congratulations to her. Thank you.
Yes, congratulations. And now we'll move to the College of Population Health. Dr. Tracy Collins.
Yes, good afternoon. It's my pleasure to introduce two of our faculty members who've been promoted to full professor. I'm going to start with Dr. Francisco Sotomas. Dr. Sotomas has an extensive history. He joined UNM in 2012 and was granted tenure in 2014. He has a diverse educational background and more than 30 years of professional experience. He holds a medical degree, a master in public health, and a PhD in health, physical education, and recreation. He also has postgraduate training in nutrition and sports medicine from accredited universities in Spain. He fulfills an important teaching role in our college and the community health concentration. He has developed syllabi and continues to do so that include very specific and measurable learning objectives and evaluation approaches, such as self-assessment and peer evaluation. And he also provides opportunities for students to interact and develop critical thinking. We need more Sotomas in the program, is how one student described him. His research is transdisciplinary, consistent with his diverse educational background, and he has a social and behavioral scientist background which brings unique research skills, because of which he uses both quantitative and qualitative methodology, designing observational and intervention studies, cross-sectional, and he also develops and implements community-based interventions. He's been very active in the college. He has completed more than 60 research projects and published more than 60 peer-reviewed articles in both English and Spanish. The quantity and quality of his research and scholarly work are recognized nationally and internationally. So we are very fortunate to have Dr. Sotomas. It is my pleasure to just say congratulations for being promoted to full professor. I'd like to move now to Dr. Lisa Kakari-Stone. Dr. Kakari-Stone received a PhD from Brandeis University in 2004 in the discipline of health and social policy. Please note that Brandeis prepares the next generation of thought leaders through transdisciplinary social sciences training, including economics, political science, mixed methods research methods, and law and health. With Dr. Kakari-Stone's research interest, she has a very diverse background as well. Her research interests encompass the macro level determinants of health and health reform, all on the community level, on the micro level. And so her research background is very, very deep, and it crosses a lot of areas. And so we have an asset in having Dr. Kakari-Stone. She's been described as a visionary in the field of community engagement and health and social policy research. She has extensive and long-term dedication to improving the health of the Hispanic and Latino population, especially the most vulnerable immigrants and refugees, yet also maintaining commitments to rural and frontier, as well as Indigenous, African-American, and other underserved vulnerable communities. These commitments are exemplified throughout her scholarship, her mentorship, her educational activities, and her impacts on health. Dr. Kakari-Stone has brought a substantial amount of extramural research dollars into UNM, more than 20 million, and her recent major accomplishments include serving as principal investigator for the Transdisciplinary Research Equity, and Engagement Center for Advancing Behavioral Health, or what's called the TREE Center, which is housed in the College of Population Health. It's one of only 12 NIH-funded health disparity centers in the country. Her leadership capacity has successfully engaged collaboration across campuses and throughout the country. We really value the leadership of Dr. Kakari Stone. She's taken our college, our university-wide to the next level when it comes to community engagement. When you think about TREE, there are multiple components. There are 2 5-year research projects looking at the intergenerational zero suicide prevention program in San Felipe Pueblo, and the Immigrant Wellbeing Project with multiple partners that connects university students with families to improve mental health and social and legal support to Mexican immigrants in Albuquerque. There's a lot that Dr. Kakari Stone brings, and we hope to see more of her leadership in UNM. And I just want to say a huge congratulations to both Dr. Kakari Stone and Dr. Sotomas. Thank you.
Yes, congratulations to you both. And now moving to the Health Science Library and Informatics Center. We have Dr. Melissa Vincent. I hope I said your name correctly, to present your candidate. I didn't. I'm so sorry.
No worries. Please. No one can. Thank you so much.
Tell me the correct pronunciation. I'll get it right next time.
It's Rethlefsen. It's pronounced just like it's spelled. Yep. But it's a tongue twister, so no worries at all.
Thank you.
All right. Well, thank you so much for having me here today. I'm truly delighted to be here today to introduce Dr. John Eldridge, who was promoted to full professor in HSLIC. I'm sure that many of you know John through his tremendous accomplishments throughout the HSC. In addition to his role in HSLIC, John also has appointments in the School of Medicine and the College of Population Health. John is also a true pioneer in health sciences librarianship, and I personally am really grateful to have the opportunity to work with him here at HSLIC. John is actually one of the internationally recognized founders of the entire field of evidence-based librarianship, and he's been instrumental in moving our entire profession forward. His research is extraordinary and robust, and he's one of the few in our field who is regularly conducting research such as randomized control trials. His expertise in research led him to help set the Medical Library Association's official research agenda, and he also helped to kick off a massive research synthesis project, which identified the existing knowledge and the knowledge gaps in our field. One of our colleagues said of John that he is a master at publishing on all facets of the work he does, and is an excellent example for junior faculty on how to publish on teaching and curriculum development work. Indeed, John is more known here as an educator. A UNM colleague said, to watch John teach a class was for me like taking a master class in the application of the most current evidence-based teaching methods. John's students agree. He has won at least 12 teaching awards, including the prestigious Lucretia McClure Excellence in Education Award, which is the highest award for educators in our profession. One of his students said that he fosters exceptional and deep student learning, both inside and outside of the classroom. Congratulations, John. We're really proud of you.
Yes, thank you, everybody. Now we are going to move on to the School of Medicine recognition. And we will have, I'd like to introduce our interim dean, Dr. Michael Richards, as he's going to be helping the chairs discuss all the folks who got promoted and received tenure. I think the next, we have 2 awards that the School of Medicine gives for excellence, and I'm had the privilege to review the candidates and have the committees report to me for those 2 awards. And so I think I will do those at this time, and then we'll move on to the different departments and the people, the faculty who've been promoted and received tenure there. So I will start with the Gold-Headed Cane Award for the School of Medicine. And so on behalf of the Gold-Headed Cane Society, it is my pleasure to announce this year's recipient. The gold-headed canes in medicine date back from the late 1600s, an era when they were seen as the universal symbol of the profession, just as we see the stethoscope and white coat today. The passage of one particular cane from Dr. John Radcliffe, widely acknowledged as the preeminent physician of his age, to Richard Mead in 1714, as a symbol of respect and the anointing of someone in whom he saw a worthy successor, began a tradition. The cane's subsequent passage to Matthew Bailey over a 125-year period and a popular book describing this cane's journey made the bestowing of the gold-headed cane a symbol of excellence, signifying in its award those qualities of head, heart, and hands that exemplify the best of the medical profession in clinical practice, academics, ethics, professionalism, community service, and advocacy. I'm delighted to acknowledge Dr. Jeffrey Bullard-Barrett, Professor of Emergency Medicine, as this year's recipient. According to his letter of nomination, Dr. Bullard-Barrett has made outstanding contributions to clinical care, advocacy, and education at UNM in New Mexico, nationally, and even internationally. He is a top clinician within the Pediatric Emergency Medicine Division. He has tremendous acumen, superb procedural skills, wonderful rapport with families, amazing composure with critical cases, and outstanding productivity. Because of these qualities, he's the clinician that fellows and faculties most desire to emulate. Dr. Bullard-Barrett recently joined the Child Abuse Response Team, which has helped to strengthen child abuse recognition and management in the emergency department. His key academic missions are care for underserved populations, trainee education and mentorship. He has improved child health equity in New Mexico as the medical director of the UNM Child Ready Program's virtual pediatric emergency department, a key outreach innovation that received the Redefining American Healthcare Award for Innovation in Children's Health from the Healthcare Leadership Council in 2020. He's also a superb educator, has received 8 faculty teaching awards, has mentored over 40 trainees and faculty, and served as the vice chair for faculty development. In 2006, he initiated a UNM teaching collaborative with Sendai City Hospital in Sendai, Japan. This relationship has lasted 15 years and fostered the career development for countless trainees and faculty. Congratulations, Dr. Bullard-Barrett. Our second School of Medicine award is the School of Medicine Community Engagement Award. And this award recognizes exceptional scholarly work that embodies the School of Medicine's commitment to community engagement that profoundly and systematically affects the relationship between the School of Medicine and the larger community in a positive and meaningful way. The scholarship or the creative work of the nominee must be of the highest quality and should be tied to the faculty members' expertise, be of benefit to the external community, be visible and shared with community stakeholders, and reflect the mission of our school. It's my honor to state that this year's recipient is Laura Banks, tenured Associate Professor of Emergency Medicine. So Dr. Sally Davis noted in her letter of recommendation that Dr. Banks' record of community service is matched by her outstanding research and scholarly works. She is passionate about the practices of emergency medicine and public health, often merging the two in her own work while educating others about the relationship between the two. Her focus includes intentional and unintentional injury prevention, infectious disease, community-based emergency care, and disaster preparedness and response. She has demonstrated the ability to translate science into practice without losing fidelity to the science or compassion for the community and its needs. This is a rare ability and one that takes insight and hard work to integrate and operationalize into academics. And then Dr. McLaughlin stated in a letter of support, the last 18 months have been defined by the most significant public health crisis in over 100 years. The response to COVID in New Mexico is widely seen as one of the most effective in the country. There is one individual who has been a consistent leader guiding these difficult times for the state since its beginning, and that individual is Laura Banks. I believe that at this time, her work is one of the most important examples of community engagement in the last 100 years. She has led the medical advisory team at the expense of her other career activities, her personal life above and beyond any reasonable number of work hours. And the result is that she has helped save countless lives in New Mexico and built a critical framework for future collaborations. Dr. Banks was recognized for her important contributions by the governor and the New Mexico legislature by designating July 22nd, 2021 as Laura Banks Day. Congratulations, Dr. Banks. Thank you for your incredible contributions. And I will now turn it over to Dr. Michael Richards to introduce our chairs.
Great, thank you very much, Dr. Wilson. So we are very pleased to advance 56 faculty members from the School of Medicine for promotion across 13 departments. I just want to note that this extraordinary accomplishment of academic and achievement, both in education and research and innovation, has occurred during an unprecedented time of clinical demands on the School of Medicine faculty. And so while this is always a moment for celebration, this recognition is even greater today because of the backdrop of this public health crisis that you just talked about. And so with that, we will have each of our department chairs announce their faculty members as we celebrate their accomplishments. And that begins with Dr. Eve Espy from the Department of Obstetrics and Gynecology.
Great, thank you. Great, thank you so much. I really appreciate being part of this celebration. Congratulations to everybody who's been recognized. I'm thrilled to have two of my faculty who have been promoted to present, and I'll start with Dr. Jillian Burkhart. I'm thrilled to present Dr. Burkhart for promotion to Associate Professor. She is the Associate Chief Quality Officer for UNMH and the Medical Director of Labor and Delivery. She is above all known for her efforts in quality and her exceptional systems and logistics focus. After medical school at the University of Minnesota, she trained in OBGYN at Boston Medical Center. She has extensive global experience from her time as a Peace Corps volunteer in Madagascar through her work with Doctors Without Borders and other NGOs in Africa to combat maternal mortality, Ebola, and to expand access to safe abortion and family planning care. We were so fortunate to recruit Dr. Burkhart to UNM, where her global expertise has been critical in the work that she's done both here and throughout the state to improve the safety and equity of maternity care. Dr. Burkhart is the clinical chair of the State of New Mexico's Maternal Mortality Review Committee. She is also a board member of the New Mexico Perinatal Collaborative, which helps disseminate safe maternity care practices throughout New Mexico utilizing Project ECHO. She was recognized for her work on L&D with the Dynamic Dyad Award with her hospital partner and with an Educational Project Award for improving patient discharge information at the UNMH Annual Quality Symposium. Please join me in honoring Dr. Jillian Burkhart's promotion to Associate Professor. And I'll move on to Dr. Lisa Hoffler. Dr. Lisa Hoffler is Clinical Vice Chair of the Department of OBGYN and also Chief of the Complex Family Planning Division. Dr. Hoffler's skill set is so extensive, it covers all areas of academic endeavor. In addition to her expertise in clinical care, education, and research, she has a specific and unique skill set in the business of medicine. Dr. Hoffler attended medical school at Emory, where she also completed a master's in public health. She completed her OBGYN residency at Beth Israel in Boston and her fellowship in complex family planning at Emory, where she also earned an MBA. Armed with more degrees than you could shake a stick at, we were so fortunate to recruit her to New Mexico, where she has used every one of those degrees to improve the health of New Mexican people through clinical care and advocacy, and to educate the future workforce of New Mexico. To name just a few accomplishments, she has been an exceptional medical director of the Center for Reproductive Health, earning that clinic the Clinic of the Year designation twice in the last 3 years. She helped achieve ACGME accreditation for our Complex Family Planning Fellowship and has been the block chair for the Phase 1 Block Human Sexuality and Reproduction. Nationally, she is the vice chair for the American College of OBGYN Finance Committee, and back here at home, she is PAG chair-elect. There are truly not enough superlatives to describe Dr. Hoffler's extensive work and achievements. I'm so proud to present Dr. Lisa Hoffler in her promotion to associate professor.
Great. Thank you very much, Dr. Espy. Next, I'd like to introduce Dr. John Merrick, interim chair of the Department of Surgery.
Thanks, Dr. Richards. All 7 are promotions in the Department of Surgery are from assistant and associate professor and clinical educator track. Now be presenting 5 outstanding faculty members today. First is Dr. Tara Brennan, who is an alumni of the University of Illinois College of Medicine, where she graduated as the top medical student in her class. She completed her otolaryngology residency at the University of Illinois and facial, plastic, and reconstructive surgery in New York. Dr. Brennan was recruited to UNM in 2015 to build both clinical and residency educational programs in facial plastics and reconstructive surgery. From a clinical standpoint, Dr. Brennan is one of the most productive members of the ENT division, performing a wide range of complex surgeries for pediatric and adult patients, including rhinoplasty, head and neck reconstruction, vascular anomaly surgery, pediatric facial plastic surgery, and facial reanimation. Despite how busy she is as a clinician, she has maintained a commitment to the education of residents and students, has been very productive from a research standpoint. A medical student commented, "The first time I saw a patient hug Dr. Brennan, I was surprised, and I couldn't help wondering if they were friends. However, the more I observed Dr. Brennan, the more it kept happening. Her patients absolutely love her. With each interaction, I observed Dr. Brennan made her patients comfortable and confident that they are in the most capable hands possible." Congratulations, Dr. Brennan. Next is Dr. Stephanie Fine. Dr. Fine grew up in Santa Fe and graduated from the UNM School of Medicine. She completed her surgery residency at University of Utah and spent the next 18 years in community-based general surgery in Salt Lake City. She returned to Albuquerque as a private practice breast disease specialist, but elected to return to academics, accepting a position with UNM in the Division of Surgical Oncology in 2014. Since joining UNM, she has rigorously developed a strong breast surgical oncology program in line with the mission of UNM to improve health and health access of New Mexicans. Her division chief, Dr. Bridget Fahey, commented, "Dr. Fine is an impeccable surgeon and clinician. She capably serves as the lead of the breast surgery program. She's well respected by her colleagues and demonstrates the highest standards of patient care and a consistent commitment to ensuring that her patients receive timely, evidence-based, and compassionate care. Her work related to racial disparities in breast cancer outcomes, enhanced recovery protocols in breast surgery, and differences in breast cancer screening for medically underserved women has been presented at both local and national levels." The chief resident commented, "For example, serves as a compass, guiding residents to become the physicians they are intended to be. Her discipline and spirit reflect the best qualities of the health sciences community." Congratulations, Dr. Fine. Third, we have Dr. Karen Hawley, who grew up in Colorado and graduated from Boston University School of Medicine. She completed her residency in otolaryngology at the Cleveland Clinic and subsequently completed fellowship training in pediatric otolaryngology at the Medical University of South Carolina. Dr. Hawley has been an active member in the department since her joining in 2015. She's clinically extremely productive and has certainly made her mark in the division of otolaryngology by creating CME events, expanding the resident curriculum, and starting the New Mexico Society of Otolaryngology in 2016. Academically, she's had several research endeavors, including an NIH-funded study on hearing loss in infants. Dr. Hawley has had a special interest in pediatric hearing loss and ear surgery. She developed a pediatric program for cochlear implantation to permit children with deafness to gain the potential to develop normal speech and receive a mainstream education. Since January, she has served as the chair of the Physician Advisory PAG Group, which is a great honor to be elected by her peers from all disciplines, and has become a recognized leader strongly advocating for improving physician ease of practice at UNM. Congratulations, Dr. Hawley. Next, we have Dr. Dunkel Meiklejohn, another ENT provider. Dr. Dunkel Meiklejohn completed medical school training at Dartmouth and his otolaryngology residency at Stanford University. He joined UNM in 2015 and immediately took over a busy clinical practice in surgical and general otolaryngology. Dr. Meiklejohn rapidly became a vital faculty member for support of resident education and well-being, and was tapped early on to take on the role of ENT program director. Since assuming this role in 2019, right before the start of the COVID pandemic, he has successfully grown the program and made multiple unique improvements to the residency with unquestioned success as demonstrated by commendations from the ACGME annual review. Dr. Meiklejohn participates in an average of more than 35 hours of direct educational activities per week and has received the Student-Driven Award for Excellence in Medical Education each of the last 3 academic years. A comment from a medical student, but here's the moment that makes Dr. Meiklejohn special, makes him better than your average excellent educator. After the case was over, he handed me an evaluation form for him to offer him feedback. He generally cared about how medical students learned from him and wanted to improve. Congratulations, Dr. Meiklejohn. Last, Dr. Lorraine Valdez-Boyle is a success story for the UNM Department of Surgery, as well as the School of Medicine. As a native New Mexican growing up in Espanola, she worked hard to overcome obstacles and was the first in her family to attend college. She completed both medical school and her general surgery residency at UNM and went on to complete a colon and rectal surgery fellowship in 2005. Over the next several years, Dr. Valdez-Boyle provided surgical coverage to rural communities, both in her hometown of Espanola and in the furthest corners of New Mexico. She was recruited to work as a staff surgeon at the New Mexico VA healthcare system in 2008. Upon joining the VA team, she developed several new programs to improve colorectal surgical services for veterans. In 2018, she was selected to be the acting chief of surgical services, and 2 years later became the permanent chief of surgical services, a role in which she manages the day-to-day functions of a service which is 124 FTE strong. The direct and immediate results of her efforts have been an improved system for care of veterans. Dr. Lorraine Valdez-Boyle is an asset to our department and institution and has worked her way to excellence in clinical care, education, and leadership. Congratulations, Dr. Valdez-Boyle. Thank you, Dr. Richards.
Thank you, Dr. Merrick. Next up, we have promotion of Dr. Amy Schmidt to professor in the clinician educator track in the Department of Dermatology. And I will do this one on behalf of the Department of Dermatology, as Dr. Schmidt has been serving as chair of that department since 2017. Dr. Schmidt is a pediatric dermatologist, and in fact, she's our only board certified fellowship trained specialist in this area for the state of New Mexico. Her clinical accomplishments are many. She continues to be very active in her clinical practice, particularly in the area of serving children, teens, and adults locally throughout the state. 2 specific clinical things that I would like to note about Dr. Schmidt are that she has really been a very early adopter in our organization and developer of teledermatology, which has really helped inspire the adoption of telemedicine techniques across multiple other disciplines. Dr. Schmidt is also very interested in vascular abnormalities and is a founder of a multidisciplinary team clinic dedicated to the care of these pediatric and adult patients with this unique condition. Under her leadership, this group has grown to 12 extremely dedicated providers and now has a database and a clinic panel of over 300 patients. In terms of clinical leadership, Dr. Schmidt has been a former member of the Physician Advisory Group, was one of our initial leaders in the Mission Excellence Steering Committee. She has been the former Chief of Staff of UNM Hospital and is a board member of the UNM Hospital Board of Trustees. But one of the most important accomplishments that Dr. Schmidt has had for our organization has been in the area of the educational mission. Dr. Schmidt led the rebuilding of our dermatology residency program in 2018. And we are very pleased to report that it graduated its first 2 trainees in June of 2021 this year. Dr. Schmidt is also very active in scholarship and research activities. She has supervised or authored over 25 publications in peer-reviewed journals, is very active mentor with over 15 active mentees. We're not the only ones that recognize Dr. Schmidt's incredible accomplishments. In 2019, she was noted to be a top doc award by the Albuquerque Magazine. She has been recognized for her outstanding services by the UNM Board of Trustees and as an outstanding faculty speaker by the medical students for phase 2. Please join me in recognizing and congratulating Dr. Amy Schmidt. Thank you, Dr. Schmidt. Now we'll move to Department of Anesthesia and Critical Care to be presented by Dr. Christopher Arndt.
Thank you, Dr. Richards. The Department of Anesthesiology and Critical Care Medicine has 4 promotees this year. First of all, I'd like to say thank you to all their hard work and congratulations to the awardees and promotees. You have a lot to be proud of. We have 4 going up to the ranks of clinician educator, 1 associate professor. The first promotee is Dr. Radhika Grande. Dr. Radhika Grande came to us after finishing her interventional pain fellowship in 2015 from Cleveland Clinic Foundation and has been a true leader in our multidisciplinary pain center located just below the main operating room here. And she is an expert in a variety of interventional and multimodal treatments of a variety of different pains, including acute on chronic, cancer pain, and is a leader in developing and learning new techniques for interventional pain management of patients. She loves to teach in the pain center, and the pain center has never had a shortage of learners. And I think a lot of this has to do with the passion that she brings to the clinic every day and the energy that she has to really bring along the learners and show them what it means to learn about pain and how an important part of someone's life pain can be if treated correctly. She trains palliative care residents, neurology residents, psychiatry, internal medicine, leads our own residency rotation, and has been a core member of our own fellowship in interventional and chronic pain. I'm also proud to say that Dr. Grande has been a director at Project ECHO, teaching in the substance use disorder and chronic pain section of Project ECHO, and has been a leader teaching at the national level as a national speaker as well. Congratulations, Dr. Grande. You have a lot to be proud of. Thank you. Our next promotee is Dr. Krajuta Sonaru. I'm waiting for her smiley face. There she is. And of course, she's up there in the Children's Pavilion because that's what she does. Dr. Sonaru, I'm proud to say, has been with us since 2008 and has been a steadfast member of the pediatric division. At one point, we were down to 3 full-time pediatric anesthesiologists, and Dr. Sonaru has really helped keep the ship afloat and is an amazing clinician, not afraid of the most difficult cases, and is well known by her colleagues in the NICU and in the PICU in the operating room, and she has a lot to be proud of in her clinical care. She's also been an immense leader in scholarship, and she has at least, I lose count, every time I look, there's another paper or abstract or project she's done, at least 15 research projects underway, and a leader of several different registries, including the Craniofacial Task Force, Pediatric Anesthesia COVID Collaborative, the Pediatric Airway Complications of COVID-19 Registry. Well, you can do a lot of scholarship yourself, but if you keep it all to yourself, that's not nearly as fun. And Dr. Sonaru takes it upon herself to lead and mentor learners and other faculty in scholarship, and has helped at least with 60 different papers and projects of other people, and is always willing to help them get a publication out the door, get a talk ready to go, or get their speech ready at the national level. She has so much to be proud of, service to the institution, and has been a longtime member of the UNM's Faculty Senate and HSC Council. Congratulations, Dr. Sonaru. Our next promotee is Dr. Brian J. Starr. Went to the rank of professor, clinician, educator. Not sure if Brian was able to join us, but I'm not going to skip over him because I am also proud of him. Many of the people in anesthesiology work many hours in clinical care, and Brian is definitely one of those people where he's put in so much time in his clinical work. Not only time, but his breadth of expertise is quite astounding. He's in 2 different divisions, cardiac anesthesia division and the regional acute pain division, and runs the board in the main operating room, oftentimes way into the early morning hours. If you're going to have a trauma and be taken up to the operating room, the person you want to see up there is Brian Starr. He's nationally known for his expertise in regional anesthesia and has spoken at least 10 national conferences. He's spoken at the state level multiple times. He's also been able, despite a very heavy clinical load, to have published and written multiple book chapters. He is truly an expert across the board in anesthesia. I'm very proud of Dr. Starr. Congratulations. And last but not least, Dr. Tony Yen, going up to the rank. There's Tony. Hey, Tony. Going up to the rank of professor, clinician, educator. Tony also is somebody who has a great breadth of expertise, and he has definitely laid down quite a path for others to follow as past leader of our acute pain service, also a leader in the operating room, manager in the operating room. And he's also been a leader in developing new curriculum and figuring out ways that we can make our residency program cutting edge to reflect the modern methods for teaching and curriculum development and feedback. He's been our assistant program director and our program director for our residency. And he must have been really bored after that because he decided to step into a brand new role and is now the Assistant Chief Medical Information Officer for Perioperative Services. And now he's spending day and night on all kinds of Zoom meetings and projects trying to lift the immense weight of the process improvement for informatics that are so important for clinician wellness and patient throughput through the hospital. Tony is a true leader and innovator within the department. Congratulations, Dr. Ian. Thank you.
Thank you, Dr. Arndt. Next up, I'd like to introduce Dr. Bob Skank, Chair of the Department of Orthopedics.
Thank you, Dr. Richards. It's a real pleasure to be here today. I have to first start off by thanking our good friends, Drs. Wilson, Siegel, and Sood for all their work for these dossiers, promotion, and tenure activities. A special thanks as well to April and Laree. You've always been over the years just wonderfully supportive. And I'd also like to say a big thank you to Kim, David, and Victoria in the PT division, as well as Gail Case, Darren Krehoff, and Leandra in orthopedics. We have 7 people going up this year for promotion and tenure. 2 could not make it. Our first is in the division of physical therapy. And I didn't see Dr. Beth Jones on the Zoom. If she is on, I would have her introduce these 2 faculty members. But I did not see her. So I'll proceed. Our first awardee is Deborah Durfler, Dr. Deborah Durfler. She is an associate professor, clinical educator in the division of physical therapy. In PT and physical therapy, they changed the rules. So Many people were trained in the modern era as a master's of PT, and then they changed it to the doctor of physical therapy. And Deb went back, got her DPT, then got her PhD. And she's one of these remarkable clinicians who I worked with her on the clinical side for many years. And she's like, that's not enough. I want to be a faculty member. I want to be a professor. I want to do research. I want to teach. And so Dr. Derfler transferred from a clinical background and now does beautiful research, clearly is an orthopedic educator expert, but also does very good evidence-based research in biomechanics in the division of PT. And it's a real honor to congratulate Dr. Derfler. Thank you so much for all your service. Our next awardee is superbly talented is Dr. Tiffany Anash. Again, she is also a doctor of physical therapy. If we could get Tiffany's picture up. Don't know if it's there. Very good. Tiffany has done tremendous work in the division of physical therapy. She is the director of clinical education and has to create all the rotations for the physical therapy students around the city and New Mexico, and does it with great style and panache, and then continues to do her faculty work as an excellent educator with multiple teaching awards. It is our great honor and privilege to congratulate Dr. Tiffany Anash and thank you for all of your excellent service and work to UNM. Next is another very unique and talented individual, Dr. Eric Liu. Dr. Liu is a podiatrist, and Dr. Liu came from University of Arizona, where he was working on a diabetic foot project, and we were able to recruit him along with a collaboration with Dr. John Merrick in vascular surgery before he became chair. And in turn, orthopedics and vascular surgery created a diabetic foot service that has now grown beyond compare. It is called the Chile service. Dr. Liu is an excellent clinician and educator, has won Consultant of the Year from Internal Medicine multiple times. As well, the orthopedic residents absolutely love his ability to teach and manage these complicated diabetic foot strategies to salvage limb. He's had excellent research publications, and we're very grateful for his service and faculty performance as our Chile director. Thank you again, Dr. Liu. Next to our two tenured faculty members, Dr. Nathan Morell is an associate professor with Tenure. He is a hand surgeon and does very complex wrist and hand surgeries. He trained with us at the University of New Mexico in orthopedics, grew up in Wisconsin, went to Notre Dame, and then trained at Stanford for medical school, and has become very experienced in all areas of hand. And he was an assistant professor for 3 years at the University of Vermont, and came back with us. And using his time at Vermont, it's a very useful strategy. And I have to thank, again, Dr. Wilson for this. We really use his time at Vermont, and he is now an associate professor with Tenure. He is a fellowship director for the hand surgery division, and we have 2 fellows per year. He's clinically superb, outstanding educator, and loved by all the residents. Congratulations to Dr. Morell. And then of the attendees today, before I start with her, I'd like to also congratulate Garen Tremy as advancing to professor, clinical educator, and to Eric Benson advancing to clinical educator, although they couldn't attend. We're very proud of what they have done for this university. So last but not least is Dr. Deanna Mercer. Dr. Mercer grew up in Puerto Rico and then landed in Las Cruces, where she fell in love with medicine, as her mother is a beloved family medicine physician in Las Cruces, New Mexico. Dr. Mercer knows no limits in her ability to work and smile and be happy. She's a prolific researcher and great role model and mentor for any woman who wants to go into orthopedic surgery or hand surgery for that nature. Together, along with many of the residents, the women residents in orthopedics and in our faculty members, we have collaborated with the Jacqueline Perry initiative, where we host high school girls from around New Mexico every year to teach them an ability to look at STEM in a way that they know they can succeed, become a physician, an engineer, or even possibly an orthopedic surgeon. Dr. Mercer, thank you for all you do, for your service. Your energy is limitless, and we appreciate all that you've done for this state and this university. Congratulations.
Thank you, Dr. Skank. Next, I'd like to introduce Dr. Nancy Carnegie, Department Chair of Cell Biology and Physiology.
Thank you. And so it's my pleasure today to introduce Dr. Nikki Jernigan. There's Nikki. Dr. Jernigan, who is being promoted to the rank of professor in the Department of Cell Biology and Physiology, grew up in New Mexico and completed her graduate training here before moving to Mississippi to complete the University of Mississippi, where she completed postdoctoral training. And then she returned to UNM in 2008 and has been with us ever since. As a faculty member here at UNM, she has been very productive with multiple research awards, starting with a KO1 award and then moving on to a couple of RO1s and some society awards. Her research in the area of acid sensing ion channels type 1 has uncovered a really novel role for this channel that hadn't been known previously in the pulmonary circulation. And to quote a couple of people who wrote letters for her outside the university, one told me that I met Dr. Jernigan at a Grover conference in Colorado in 2008. Her presentation was the high point of the meeting for me, and it was clear she was someone to watch, and her progress has amply borne out my initial impression. And from another reviewer, Dr. Jernigan's work on ASIC is pioneering and creative. Her work has had and continues to have a substantial impact on the field. And because of these things, we are very proud of our homegrown Dr. Jernigan and all of the contributions she makes. But in addition to her research, she's also been active in service and in teaching. Outside of the School of Medicine, she has served on and most recently chaired the UNM Senate Graduate and Professional Committee, and she has served on the UNM Academic Council. At the national level, she has served on multiple committees, including the American Physiological Society's Educators Committee. And by APS, she was selected to represent the society and to give a keynote address recently at a physiology society meeting. Dr. Jernigan is highly committed to making the University of New Mexico and the School of Medicine an outstanding institution for research and for teaching. Her trainees also wrote outstanding letters of reference for her. She's recognized as an energetic, committed, and truly caring educator. And her presentations are textbook quality every time she opens a PowerPoint. So we have come to rely on her, to respect her, and all of us in the department say congratulations, Nikki.
Thank you, Dr. Carnegie. Next, I'd like to introduce Dr. Loretta Cordova de Ortega, Chair, Department of Pediatrics.
Good afternoon, everybody, and congratulations to all the awardees. And I'm pleased to recognize two faculty who are here and one who is not here. I'll start with Dr. Alfonso Belmonte, who is one of our hospitals, who was promoted to associate professor and has done outstanding work in education as well as in DEI. And unfortunately, he couldn't be here with us today. Next, I would like to acknowledge and recognize Dr. Anna Duran. Dr. Duran is a native New Mexican, grew up here in Albuquerque and graduated from the School of Medicine here at UNM in 2005 and on our residency program in 2008. And we quickly recruited her to stay on as a hospitalist here. And so she has dedicated her career to excellent care of hospitalized patients and truly worked also not just in the hospital, but in our community. She's worked voluntarily at a New Futures clinic and also a continuity clinic of her own, and then went on to create a clinic for medical students for children who are facing homelessness. And all this in the setting of being a hospitalist, but also caring for her community. So remarkable work. She's an outstanding educator and has received numerous teaching awards, as well as the Humanity in Medicine Award. And she extends her education beyond the walls of teaching residents and medical students here, because she also works out in the community and education through the emergency medical services. And she provides education to rural EMS workers throughout the state. She's created curriculum for simulation education to allow people to learn in the remote areas that they live in. And she's a reviewer for course content in international meetings on stimulation in healthcare. She's an advocate for greater Albuquerque community and has volunteered in policy councils for early Head Start programs, Pediatric Health Advisory Committee, and child abuse prevention. Advocacy for children is evident in her scholarship as well. And she's an investigator in the housing and food insecurities in pediatric populations. Dr. Duran is an outstanding administrator and has served as an assistant clerkship director, medical director for our general pediatric units. She was elevated to the vice chair of clinical services for the department and now is the CMO for our children's services. And I think this is a testament to her excellent work and her commitment to UNM. And we are very proud of her. So I'm proud to congratulate you, Dr. Duran, on your promotion to professor. Next is Dr. Lanier Lopez. Dr. Lopez is also a native from New Mexico, from Cimarron, New Mexico, a very small community in northern New Mexico. And she completed her UNM School of Medicine and graduated from here and completed her residency training at Johns Hopkins Hospital, Children's Hospital. And we were able to recruit her back to New Mexico in 2009, and she serves as a pediatric hospitalist as well. Dr. Lopez is an outstanding educator and began as the director of our residency inpatient rotation, and then very early on was engaged in the National Association of Pediatric Department Program Directors and ultimately became our residency director. She was a site director for multiple projects with the National Association of Pediatric Program Directors, and she has fostered and mentored many residents and faculty to lead projects and present regionally and nationally. She's engaged in the National Education Leadership and selected as the vice chair of the meeting for Western Society for the Association of Pediatric Program Directors. She's also a senior member of our hospitalist group, and she's been a member of the National Quality Improvement Projects, including projects related to bronchiolitis, sedation, and discharge processes. And this national work that she's done has really brought us to a great level here at UNM to provide excellent care for our patients. Dr. Lopez also has excelled as a leader, and her excellence and commitment and value to UNM is reflected in her outstanding administrative roles. She served as the residency director, the program director, and now is the vice chair of education for the department, and also the assistant dean of GME. So truly a testament to the outstanding work she's done as well. Congratulations, Dr. Lopez.
Thank you, Dr. Cordova de Ortega. Next, I'd like to introduce Dr. Nancy Jost, Interim Chair, Department of Pathology.
Good afternoon. I am very happy first to congratulate Dr. Nadja Falk on her promotion to Associate Professor of Pathology. Dr. Falk joined our faculty in mid-2019 after 4 years as an assistant professor at Tulane University. And she brought a wealth of expertise in surgical pathology, cytopathology with a strong focus in gynecologic and breast pathology, very, very important for our service. And since her arrival, Dr. Falk has just wholeheartedly immersed herself in our School of Medicine community. She's very active in her clinical service and very active in research. She's now Senior Director of UNM Hospital Cytology Service. She's the director of our Cytopathology Fellowship Program. She serves on the School of Medicine Admissions Committee. She is a UNM faculty senator, and she is also the president of the now revived New Mexico Pathology Society. So, and this is just in 2 years. So she is just a highly valued member of our department, and this promotion is very well deserved. So congratulations, Dr. Falk. I'm very pleased to congratulate Ms. Elizabeth Johnson on her promotion to Senior Lecturer 2 in our Medical Laboratory Scientist program. Ms. Johnson joined our faculty in Med Lab Sciences in 2015 with deep subspecialty expertise in hematopathology, and she is actually titled as a specialist in hematology. In addition to this expertise, she has a very strong dedication to education and has enhanced her education skills with courses at UNM, CNM, particularly with online course design, in which she has received awards for her course design. Ms. Johnson is an active member of the School of Medicine community and serves on a number of very important School of Medicine committees, such as Academic Appeals Committee and the Anti-Racism Committee. And she's just a very highly valued member of our department and the Medical Lab Science team, and this promotion is very well deserved. So congratulations, Ms. Johnson, on your promotion. And next, I am just very happy to present for promotion Ms. Margaret Alba to Principal Lecturer 2 in the Department of Pathology. Ms. Alba joined our faculty in Med Lab Science program in 2009 as an expert in clinical blood bank. And over the years, she has expanded this expertise in other important areas of lab medicine. We are very appreciative of her assuming leadership positions in Med Lab Sciences. She is the Associate Director of the Med Lab Sciences program and also the Director of Med Lab Sciences recruitment. She has a very deep commitment to education and her students. She is a medical education scholar and the recipient of a number of grants related to laboratory medicine education. And particularly, I think ought to be recognized is her grant enhancing the training of med lab science students in rural New Mexico and medically underserved areas where it's very difficult to staff medical laboratories. So Ms. Alba is just a very highly valued member of our department and the Med Lab Sciences team. So congratulations on this very well-deserved promotion.
Thank you, Dr. Jost. Next, I'd like to introduce Dr. Mark Unruh, Chair of the Department of Internal Medicine.
Thank you, Dr. Richards. I want to thank everyone. I want to thank everyone in attendance in support of the accomplishments of all the faculty today. I want to also recognize all the hard work of the staff in the Department of Medicine and School of Medicine and getting through these dossier packets to realize the tenure and promotion process through multiple waves of a pandemic. So amazing work, everyone. And this is a very special celebration. I first want to move to Dr. Erin Fitzgerald. Dr. Fitzgerald received her Doctor of Osteopathic Medicine at the University of New England, completing her residency at the University of New Mexico. Fitz has a special interest in the intersection of justice and healthcare and seeks to have a better understanding of bias, sources being explicit or implicit. She's a published poet, and she uses her art as a way to reflect on the caring of the patients at the end of life. And she also is the co-director and facilitator for the UNM School of Medicine Healers Art course and the clinical competency lead for the Palliative Medicine Fellowship. Fitz adds a lot to the discussion of how to educate our residents, our fellows, and our students. And congratulations on your promotion to associate professor. Next is Dr. Christina Lovato, promoted to as Dr. Lovato. She received her MD from the University of New Mexico. She completed internal medicine residency, and there she is again. She actually did an additional year as chief resident, which is no surprise given how we've relied on her as a faculty member as well. She joined as an assistant professor in endocrinology in 2014. In endocrinology and in the department, she serves multiple key roles. As a fellowship director in endocrinology, she worked with both the faculty and fellows to establish an outstanding program. She's also worked to effectively improve the efficiency of practice in the medical specialties clinic as a medical director. She's been recognized as a top doc by Albuquerque Magazine and as a 2020 Woman of Distinction Award. Dr. Lovato, congratulations on your promotion to associate professor. Next is Dr. Christos Argyropoulos. Dr. Argyropoulos graduated with an MD from the University of Petrus. He became my fellow actually at the University of Pittsburgh. And our first manuscript together was describing the influence of survival methods on clinical inference related to dialysis dose. It was published in JASN, which is the highest impact nephrology journal. He was recruited to work for AbbVie in Greece, and UNM was able to recruit him back in 2014, and he went on to become division chief of nephrology in 2017. His research focuses on understanding the mechanisms of human kidney disease, and also his teaching interests concern the interface of nephrology with primary care, as well as social media. With Christos, it's actually a point of pride for me to see the joy he's taken in caring for our rural patients. He founded a dialysis unit in Cuba, New Mexico, has enjoyed Bruno's many times in Cuba, New Mexico, and has a 5-star unit, a 5-star being a 5 out of 5-star unit in Cuba, New Mexico. He's a prolific physician scientist with 8 publications this year and ongoing support from industry and investigator-initiated studies. Dr. Argyropoulos, congratulations on your promotion to tenured associate professor. I next have the privilege of recognizing Dr. Cindy Blair. Dr. Blair is a graduate of University of Minnesota for her PhD. She was recruited to UNM in the rank of assistant professor within the Department of Internal Medicine and epibiostats in 2015. She's really successfully transitioned from a KO7 to investigator-initiating funding, kind of reflecting her productivity with over 20 peer-reviewed publications since arriving at UNM. Cindy does research that's impactful for New Mexicans. Her research program focuses on developing lifestyle behavioral change interventions to improve physical health and quality of life of cancer survivors. She had to adapt to a pandemic and learn how to assess physical activity using remote tools. She also has another project that's been to provide cancer survivors with the tools to grow their own fruits and vegetables in an adapted mentorship program. So Dr. Blair, congratulations on your promotion to associate professor with tenure. Thank you very much. Our next faculty of note is Dr. Stephen Bradfew, who's in infectious diseases, the Center for Global Health. Dr. Bradfew graduated with his PhD from the Baylor College of Medicine. He was recruited to UNM at the rank of research assistant professor within the Center for Global Health in 2013. His research focuses on immunity, therapeutics, diagnostics, and vaccine development for emerging and re-emerging viral pathogens that cause human disease. He's been busy lately with more than 15 publications in the last 18 months. In addition, he serves as chair of the Institutional Dual Use Research of Concern Committee, the laboratory director for the BSL-3 lab. He's a highly sought after collaborator. Dr. Bradfeud studies COVID-19, equine viruses, hantavirus, and he and his team were able to demonstrate for the first time using sort of whole genome sequencing, really track the likely site of human infection with hantavirus. And his love of pathogens extends to his favorite football team, the Dallas Cowboys. Thank you, Dr. Bradfeud. All right, our next faculty recognition is Dr. Eric Barty. Dr. Barty graduated with a PhD from Oregon Health Sciences University. He was recruited to UNM at the rank of associate professor within the Department of Internal Medicine, Division of Molecular Medicine in 2019, and he's been busy. Dr. Barty, his interests as a scientist involved the study of virus-host interactions with a particular interest paid to how those interactions can be used to improve therapy for cancer patients, now known as oncolytic virotherapy. He's been funded, NIH funded through R01 and R21 mechanisms with his R01 award examining the treatment of multiple myeloma using oncolytic myxoma virus. His international recognition has been demonstrated by his selection to serve as a chair in an international conference on pox viruses in Taiwan. And Dr. Barty has had an outstanding research trajectory since arriving at UNM in 2019. Despite the pandemic. So Dr. Barty, congratulations on being promoted to associate professor with tenure. Our next faculty candidate is promoted to professor in the CE track, Elena Zamora. Is Dr. Zamora present?
She's here. We're waiting for her video.
Oh.
Yeah, hi, sorry. And Dr. Zamora's daughter.
All right. Dr. Zamora and her daughter, welcome. Dr. Zamora received her MD at the University of New Mexico and did her residency here as well. She joined faculty at the rank of associate professor within the Department of Internal Medicine in 2000. She's been here since 2009. Dr. Zamora has also been at SRMC since the beginning, serving in multiple roles to help build and improve the ICU to its current level of care. She's division chief of pulmonary at SRMC. She's served as chief of staff at SRMC. And Dr. Zamora is actually importantly sort of a pioneer in terms of the relationship of UNM and SRMC. I believe she's the first kind of full-time SRMC faculty member to get promoted. So Dr. Zamora, thank you for your pioneering efforts. Congratulations on your promotion.
Thank you, everyone.
Dr. Marchetti, I believe had
He
to
was
jump
here,
off.
but he had to leave.
Okay, so we'll move on to Dr. Lambert. Dr. Christoph Lambert received his PhD at Duke University. Dr. Lambert, prior to coming to UNM, was founder, president, CEO, and chairman of the Golden Helix, founder and chair of Bozeman Systems Thinking Group. Dr. Lambert joined the faculty at the rank of associate professor within the Department of Internal Medicine, Division of Translational Informatics in 2014. There are a number of his colleagues here today to celebrate with him. His current research focus is analyzing longitudinal healthcare data for predictive and preventive medicine in collaboration with other members of the School of Medicine, as well as the Odyssey program, which is the Observational Health Data Sciences and Informatics program. Dr. Lambert has received funding from PCORI and NIH to support his work and has had more than 20 peer-reviewed manuscripts since joining in UNM. Dr. Lambert also plays a key role in the UNM CTSC, leading the informatics core, and has served to positively impact the research of many faculty and trainees at UNM through this role. Congratulations, Dr. Lambert, on your promotion to professor with tenure.
Thank you so much.
Dr. DeCladney. Is Carl here?
He's not, or he's not.
All right, Dr. Richards, I'll cede the remainder of my time.
Great. Thank you, Dr. Unruh. Next, I'd like to introduce Dr. Bill Shuttleworth to announce the promotions for the Department of Neurosurgery.
Thank you very much. So it's my pleasure to present Dr. Andrew Carlson, promoted to Associate Professor with Tenure in the Department of Neurosurgery. The chair of the department, Dr. Mike Schmidt, is unable to be here today, but generously allowed me to pinch hit and say a few words since I was one of Dr. Carlson's faculty members during his progress towards tenure. From a clinical perspective, Dr. Carlson is one of the pillars of the department and genuinely cares about the mission to serve some of the most vulnerable in our state at some of the most vulnerable times. One of these highlights is serving as the surgical director of the Comprehensive Stroke Center, which was accredited this year, and owed a lot to Dr. Carlson's tireless leadership. And that's an intentional choice of words, since he was taking Q2 call for years to make sure that we had the continuous stroke and aneurysm coverage needed for this important designation. Dr. Carlson's research achievements are remarkable. He's published very extensively. He has external NIH funding and is an editor of the Journal of Neurosurgery, the latter of which is really unusual for someone at his career stage. The thing I'll highlight is his work on brain tsunamis. Dr. Carlson is recognized internationally as a trailblazer in this exciting field as he established a tsunami recording program in the neuro ICU in the operating room here at UNM. There's only a handful of these around the world, and he has used this to provide major discoveries on how these events are involved in a range of brain pathologies and also how to treat them. Dr. Carlson is the one who pushed ahead with the first interventional trial with ketamine, and the success of this has provided the basis for the first multi-center trial using this for TBI. While this is a major achievement, you should also know that he's opening up big new fields on the impact of patient touch and injury progression in the ICU, and that involves tsunamis, on symptoms involved in subdural hematomas, and even things like tsunamis in the growth of glioblastoma. These are things that I think are going to change medicine, and soon, and UNM is recognized as a world leader in this because of Dr. Carlson's efforts.
Help us being recognized in this big ceremony right now.
So I'll also add finally that Dr. Carlson's a great teacher. Neuroblock's going on right now, and I get calls now that he's appreciated in those labs that are part of Neuroblock from medical students who really appreciate his input and his clinical perspectives. He's a research mentor for many medical students, residents, and research fellows, and was actually the recipient of the first award for residents to recognize outstanding educational efforts. So I hope these brief highlights give you a sense of what a valued colleague Dr. Carlson is and how lucky we are to have him here at UNM. And congratulations to you, Dr. Carlson, on your promotion and tenure.
Thank you, Dr. Shuttleworth. Next, I'd like to introduce Dr. Michelle Torbe, Chair of the Department of Neurology.
Thank you, Dr. Richards. It's a pleasure to introduce Dr. Sarah Pugh-Richardson, who's being promoted as a tenured professor in neurology on our departmental fast track. Dr. Pugh graduated from the University of New Mexico School of Medicine with honors in research and trained in neurology at the University of California at Davis. She completed a fellowship in movement disorder with Dr. Mark Hallett, who's internationally recognized leader in the field at the National Institute of Neurological Disorder and Stroke. She joined UNM faculty in 2007 and was the sole faculty member with expertise in movement disorder in the whole state. Since, she has grown the movement disorder program, and now there are 3 movement disorder faculty who have joined us from some of the best centers in the world. She was active in the development of the newly funded Comprehensive Parkinson's Disease and Movement Disorder Center at UNM, and was really key in testifying and presenting to the legislative committees and to the Board of Regents regarding the need for such a center to provide the state-of-the-art care here in New Mexico. Dr. Pugh research program has grown from her early years competing for intramural funds to establishing a non-invasive neurostimulation lab to her successful completion of the CTS-CKL2 Scholar program, and now to being fully extramurally NIH-funded investigator. Even in challenging funding climate, she is now funded both by the NIH and the Department of Defense to a significant portion of her for her FTE. In addition, she has developed a first-rate clinical trial portfolio, expanding access to therapeutic development for our Parkinson's disease and dystonia patient. Since her promotion to an associate professor,
I just beat level 30 really easily in rush hour.
Since her promotion to associate professor, Dr. Pirio has published 17 manuscripts out of 37 total, and has co-authored a telemedicine paper, which was named one of the best paper for 2019 by the editorial board of the Telemedicine and eHealth Journal. She's an excellent teacher and has been active in teaching medical student, resident, and allied health professional across the board. In addition, she performs community outreach and educational session in person and on virtual platform, reaching hundreds of patients and their families on Parkinson's disease and dystonia, both clinical and research topics. She has established a resident education curriculum at the VA site and completed the first module in teleneurology, a key area of her competence in the current climate and certainly in the foreseeable future. Well, that's not only what she has done. She has been continuously active in service to the medical school, department, and to the New Mexico VA healthcare system and to the community, and on the national and international movement disorder scene. She has served on key committees at the department, at the hospital level, as well in the community as the medical director of the local patient advocacy group. She has emerged as a leader with her appointment to the VA neurology chief position, as well as the vice chair for faculty development at the UNM neurology department. Dr. Pirio has been very involved in mentorship, both personally with 6 junior faculty mentee, past and present, within our department. She's developing a mentoring program in the department and new faculty mentoring snippet series for our junior faculty. She's also actively mentoring junior faculty in the research realm, including past and present NIH funding of her mentorship of the junior faculty. She has worked with undergrad and medical student across the board, resident and fellow, and also working through her international society, and is currently mentoring a Ghanaian neurologist interested in career in the field of movement disorder. Dr. Pirio has excelled in research, clinical care, education, and service, pretty much the triple or quadruple threat even. Her letter of support described her as a person with exceptional qualities. She brings to the medical school much needed expertise and has established a strong research career anchored in high quality publication and robust extramural funding. On behalf of the neurology department faculty, we are excited to see Dr. Pirio promoted to Professor of Neurology with tenure. So congratulations, Sarah.
Thank you, Dr. Torbe. Next, I'd like to introduce Dr. Felicia Rohan-Menjeras, Interim Chair, Department of Family and Community Medicine.
Hello, good afternoon, everybody. I'm pleased this afternoon to congratulate everyone who is being promoted this year. Thanks to all of you who are dedicating your careers to service, to education and research to improve the health of New Mexico. I'm very pleased to have the honor to introduce the group of outstanding faculty in family medicine who are promoted this year. I'd like to start with Dr. John Bettler. Hi, John. Dr. Bettler is the medical director of UNM Southeast Heights Center for Family and Community Health, one of our system's most productive outpatient clinics located in Albuquerque's International District, serving some of Albuquerque's most diverse but also most vulnerable populations. He also provides obstetric care on the maternal child health service, truly demonstrating the belief he has in family-based maternity and neonatal care. Dr. Bettler is consistently rated as an excellent teacher by learners, which include medical students, PA students, and residents. And he's been named the Outstanding Preceptor of the Year by our residents for 2 years. He has been exceedingly productive in leading innovations in clinical care and is diligent in his work to promote learner and provider well-being. This month, he assumed the role of clinical vice chair in our department, and we'd like to congratulate you, Dr. Bettler, on your promotion to associate professor. Next, we'd like to recognize Dr. Kate McCalmont. Dr. Kate McCalmont is also being promoted to associate professor on the clinician educator track. Hello, Dr. McCalmont. Dr. McCalmont has demonstrated her excellence in education in her service as education director, also at the Southeast Heights Clinic. After just a year on faculty, she joined the residency leadership as an associate program director. She has been an active teacher and clinician at the Southeast Heights Clinic, seeing her own patients, precepting residents, and working in the Focus Clinic. Dr. McCalmont has served on our maternal child health service and the newborn nursery. She is an excellent clinician and a dedicated teacher. We thank you for all your service and congratulations on your promotion. Next, I would like to recognize Dr. Laura Chen Barajon on her promotion to associate professor. Hi, Laura. Dr. Chen Barajon is an experienced community engaged clinician, leader, and educator. She's known nationally and internationally for her work in CBPR and PHC. Since coming to UNM, Dr. Barajon has demonstrated her unique ability to link her work as a clinician educator with community engaged scholarship by systematically including both med students and family medicine residents into education, service, and scholarship. As you all likely know, you can find Dr. Barajon these days in Santa Fe, serving as Deputy Secretary of Health, leading our state's COVID vaccine efforts. You've done incredible work during the pandemic, Dr. Chen Barajon, and we thank you for your service. Congratulations on your promotion. Next, I'd like to recognize Dr. Syria Pierce on his promotion to associate professor on the clinician educator track. Hello, Syria. Dr. Pierce has demonstrated clinical excellence at UNM through his teaching in a wide variety of settings. He has taught for at least 8 broad categories of learners, including all levels of medical students and residents from various departments. Dr. Pierce serves as a leader in integrative medicine education locally, and he serves as the School of Medicine's integrative medicine elective rotation. Dr. Pierce has been committed to providing high quality care through his clinical activities at UNM Center for Life and the 1209 Clinic. His excellence in scholarship is demonstrated by his robust record of invited lectures locally, nationally, and internationally. And his scholarly products demonstrate his competence in general topics of integrative medicine with his special interest in application of contemplative practices in the medical setting. We are grateful for his many contributions to our department and congratulate him on his promotion to associate professor. Congratulations. Okay, next, we would like to recognize Dr. Alexander Rankin. Dr. Rankin is also being promoted to associate professor on the clinician educator track. Dr. Rankin has excelled in leadership and has been in leadership roles since he first started here at UNM. As the Family Medicine Inpatient Service Medical Director and the 3 North Geographic Medical Director, he led our department and piloted patient-centered projects that enhanced emphasis on quality and patient satisfaction. He has excelled in providing education to both our learners and our faculty in his various roles across the organization. Dr. Rankin's leadership skills have been recognized and were critical throughout the pandemic in his management of many of the pressing issues that the hospital faced. He continues to utilize his excellent leadership skills and knowledge in his ACMO role at the hospital. Congratulations and thank you, Dr. Rankin, for all your service. Right. Next, we have Dr. Daniel Waldman, who's been promoted to professor on the clinician educator track. Hi, Dan. Dr. Waldman served as the director of the Family and Community Medicine residency program for 8 years. During that time, our residency flourished, and he contributed significantly to the expansion of primary care physician training in our state. The family medicine residency is one of the largest programs in the country and one of the most complex to oversee. Under his leadership, our residency enhanced its national reputation and has consistently attracted top applicants from across the country and has sought to retain many of our UNM medical school grads. As the former family medicine inpatient medical director, Dr. Waldman's clinical focus has been largely in the hospital. Including provision of great clinical care, he brought excellent teaching to our residents and students on the service, including teaching on point-of-care ultrasound. Most recently, Dr. Waldman is the principal investigator for a HRSA grant to establish a rural track residency training in Shiprock. This year, the Shiprock residency program is interviewing its first applicants. This project has a strong research evaluation component, and he's leading a team that is establishing a brand new residency program for the state. He has a broad knowledge of GME and is dedicated to expanding GME in the state to serve the needs of the people of New Mexico. We're grateful for all your contributions. Thank you, Dr. Waldman, and congratulations on your promotion to professor. All right, next we have Dr. Amy Clitheroe-Aridin. Hi, Amy. Dr. Clitheroe-Aridin is being promoted to Principal Lecturer 2. Dr. Clitheroe-Aridin has worked for UNM for more than 25 years. Her skills have ranged from being an interim chief executive officer for several of our rural hospitals as part of her administrative responsibilities at UNM to being an award-winning educator. She has an extensive history working with the preceptorship program and our undergraduate medical education programs. For years, she has consistently given more presentations to the family medicine clerkship students than any other faculty member. She has mentored numerous medical students and has more than 18 peer-reviewed publications and more than 50 poster presentations at national and international conferences. She provides important service to the medical school, enrolls on the curriculum committee and the CSPE. In addition, she has an interest in international health and keeps family medicine globally connected through many international initiatives. Thank you for all of your service and congratulations on your promotion. And last but not least, I believe, is Yvonne Ellington. Hi, Yvonne. I'm happy to congratulate Yvonne on her promotion to Principal Lecturer 3. Yvonne has been an instrumental faculty member for the PA program and has been a critical contributor to the program's success over many years of her dedicated service. She served as interim program director for a time and has very actively participated in 2 accreditation site visits. She has served as a clinical coordinator, the academic coordinator, and currently, and for 10 years, has served as the associate program director. She has historical knowledge about the program and its evolution and has been fundamental to the program's success. She cares deeply about the well-being and success of each and every PA student. She also provides clinical care at the Family Medicine Tucker Clinic, and she is loved and trusted by her patients and coworkers. As a senior faculty member at the PA program, she has mentored many junior faculty and has continued to lay a strong foundation for the program. We thank you for all your service and congratulations on your promotion. Thank you, Dr. Richards, for allowing the presentation of the family medicine faculty.
Thank you, Dr. Rothman-Harris. Next up, we have Dr. Steve McLaughlin, Chair of the Department of Emergency Medicine.
Thanks, Dr. Richards. Appreciate it. Hi, everybody. I'm going to start by just recognizing Jeff Bullard-Barrett. So Jeff, congratulations on the Gold-Headed Cane Award. Very well deserved. I also want to recognize Steve Seifert, who's not able to be here today. So Dr. Seifert's faculty in emergency medicine and toxicology, and it was the one who brought the Gold-Headed Cane Award idea here. And so I know Steve loves to present those awards, and I just wanted to recognize him for bringing that really impactful award to the institution. Also really want to recognize Laura Banks for the Community Engagement Award. Couldn't think of anybody better qualified, and Laura, you really deserve it. You've put so much work into keeping us all safe this year, so thank you. All right, so first, my first faculty member to talk about is Dr. Rachel Turry. hopefully she'll pop up. Hi, Rachel. So Dr. Turi received her medical degree from the University of Michigan. She did her PEDS residency at George Washington, and then went and did her pediatric emergency medicine fellowship at Northwestern. She came here as an associate professor from the Medical University of South Carolina, and we were very lucky to have her pick UNM as her next career move. Dr. Turi is our division chief for pediatric emergency medicine. She also serves as the medical director. She is an incredibly valuable member of our senior leadership team. She is one of those people that when I don't know what to do, I will call Rachel and we'll talk about what to do. She is just one of the kindest human beings that I have ever met, and one of the most, I think, both natural leader, but also committed to making herself a better leader and continuously a better advocate for her faculty members, tirelessly working to improve the care that we provide to our pediatric patients, and continuing to try to make our department better, the school better, the experience better for everyone that she engages with. So Dr. Turi, congratulations on becoming Professor Turi, well deserved. Next, I am going to talk about Dr. Sanchez, whether he's here or not. So I don't know whether he's here, but I'm going to say a couple things about him if that's okay. Dr. Sanchez came to us from Rutgers. He got his MD from Albert Einstein. He did his residency at Jacobi and got his MPH from Yale. Dr. Sanchez is the vice chair for DEI in emergency medicine, and in fact helped me to create that role. He's also the, I don't actually know if these titles have changed, but I think he is like the executive associate vice chancellor for DEI for the HSC, although that title may have changed. His well over 50 publications, has had enormous impacts already. He's been here for 2 years, enormous impacts already on the institution, our students, our residents, our faculty, the systems that we operate under, and the very structure of the HSC. He's been an incredibly impactful faculty member in our department, an advisor and mentor to me on issues around DEI, and a friend. And he is came in at the professor level and is now being granted tenure, which is well deserved. So JP, wherever you are, really appreciate the work that you're doing and your commitment to making this institution a better place. Lastly, if I may have one more second, I appreciate Bob earlier recognizing the staff from academic affairs. I just have to give a huge shout out to Amy Jamison, our department administrator, and all of our administrators that help put these dossiers together. It's a tremendous amount of work for the faculty. They could not do it without the staff. And we are again doing this right now for the next cohort. So it's just a continuous cycle, but just a huge shout out to Amy and all of our staff that make this work possible. Thanks.
Thank you, Dr. McLaughlin. Next, I'd like to introduce Dr. Mauricio Tohen, Chair, Department of Psychiatry and Behavioral Sciences.
Thank you, Dr. Richards. Well, I'm very proud to say that we are promoting 9 faculty members. And of course, that took a lot of work. So I need to recognize first Dr. Siegel, our Vice Chair for Faculty Affairs, and also Assistant Dean for the Office of Faculty Affairs. And then all the work done by our staff, starting with our administrator, George Corbett, Karita Cook, and Barry Noskin. And of course, the Office of Faculty Affairs, Dr. Wilson, the Director, April Rodriguez, the consultants, and the staff. And lastly, I want to thank the families of all of our faculty being promoted for supporting them, especially in the last almost 2 years of this COVID epidemic. Thank you all for supporting our faculty. So let me start with the promotions for associate professors in the clinician educator track. We're going to start with Dr. Pune Teherani. Hi there, Dr. Teherani. Well, Dr. Teherani was born and raised in Iran, where she completed her medical education. Then she came to the US and completed her residency training here at UNM. She was then a year in Las Cruces, and we were very fortunate that she came back to UNM and has worked at SRMC. Dr. Rani has a passion for serving underserved populations and also for education. At SRMC, really single-handed, she's developed the services of consultation liaison, and the other one is the behavioral care integration at the SRMC Family Practice Clinic. As mentioned, she has a passion for education. She completed the Medical Education Scholars Program, and she has served as co-chair of Medical Student Neurosciences Block and the course director for Medical Student Communication in the Trenches. Dr. Tarani, congratulations for your promotion. Next, we have Dr. Vanessa Jacobson.
Apologize, I took my camera off because I'm driving to school pickup.
Okay, just listen, and please don't get into an accident. So Dr. Jacobson grew up in Massachusetts. She attended the University of Massachusetts Medical School. Then she came to UNM, where she completed her residency in family medicine. She's also board certified not only in family medicine, but also in addiction medicine. So she is the medical director of one of our medical homes, in this case, the one at ASAP, the Addiction and Substance Abuse Program. And she is the associate program director at the UNM's Addiction Medicine Fellowship, where she has done a tremendous success. She's a preceptor for family medicine residents, preventive medicine residents, PA students, and medical students. And she also teaches the interprofessional education block at ASAP. She is also a HAP team member of 2 ECHO teams, focusing on increasing the access to treatment for opioid use disorders in community settings. Professional interests include teaching students, residents, fellows, and working with the underserved populations of New Mexico. So thank you, Dr. Jacobson, for your services, and congratulations on your promotion. Next, we have Dr. Lindsay Smart. Hi, Dr. Smart. So Dr. Smart is our training director for the American Psychological Association Accredited Clinical Psychology Internship Training Program here at UNM. And she also provides clinical services at the UNM Student Athletes Clinic. She received her VA in psychology at the University of Portland, and her master's and PhD in clinical psychology at the University of Denver. Then she came to UNM, where she completed her predoctoral internship and then also her postdoc training at the Division of Community Behavioral Health. She also is a graduate of the UNM Medical Education Scholars Program. Dr. Smart is the Associate Vice Chancellor for Leadership and Faculty Equity and Inclusion at the Health Science Center, Office of Diversity, and she's also the Director for Diversity, Equity, and Inclusion in our department. In both roles, she's got a tremendous impact in promoting diversity among faculty, students, and staff, not only in our department, but across the Health Science Center. Thank you for your service, Dr. Smart, and congratulations for your promotion. Next, we have Dr. Emiliano Valles. Do we have Dr. Valles? Hi, Dr. Valles. Dr. Valles was born and raised in Albuquerque, where he completed his undergrad at UNM and then medical school at Washington University School of Medicine. He came back to UNM, completed his psychiatry residency in 2010, and also completed his fellowship in consultation liaison psychiatry. He's been a faculty member at UNM since 2015, working in the adult inpatient consultation services. He's also been the assistant fellowship director for our fellowship program. He is committed to medical student and resident education. He is actually the Associate Medical Student Clerkship Director. In 2018, he received the UNMH Rush Pierce Outstanding Professionalism Award. Thank you for all your services, Dr. Valles, and congratulations on your promotion. Next, we move to granting tenure, and this is Associate Professor with tenure to Dr. Julie Salvador. Hi, Dr. Salvador. So Dr. Salvador is an anthropologist. So in the clinical departments, when you have a non-clinician be promoted to tenure, well, we're taking, should we say, a financial risk. But Dr. Salvador was able to fund herself within a year. We gave her 3 years, but she did it within a year, and she is fully funded. She has an interest in implementation sciences and health services research, and her focus is in rural, low resource, and high needed areas. She has served as PI and research lead in a number of funded projects by the Agency for Healthcare Research, from NIDA and from SAMHSA. In the last 12 years, she's been focusing on substance use disorders, particularly models that help provide treatment to train workforce staff to adopt, implement, and sustain evidence-based practices in rural, underserved, and ethnically diverse areas in New Mexico. Since 2017, she has worked closely with the New Mexico opioid resource grants that seek to expand access to prevention, treatment, harm reduction, and recovery services to address the opioid use epidemic. She is currently the principal investigator of a 5-year federal grant that examines the impact of ECHO. We all hear about ECHO, but this is one of few. There's a number of them, but one of the studies that actually are looking at the model ECHO, the impact that it has on communities. And Dr. Salvador is studying the expansion of buprenorphine treatment for opioid use disorders in rural primary care settings, especially in New Mexico. One of the educational focuses of Dr. Salvador is teaching our residents the development of research projects. Thank you for all your services, Dr. Salvador, and congratulations on your promotion. Next, we move to professors, and we have 2 in the clinician educator track. First, we're going to start with Dr. Altschul. Dr. Altschul did send me a message that she was going to be driving, and there she is. Don't look at us, Dr. Altschul. So Dr. Altschul is the vice chair for community behavioral health research in our department. She joined UNM in 2006. She came from the University of Hawaii. She is a member and a leader at the National Association of State Mental Health Programs, and that is aimed to improve racial and ethnic disparities in terms of receiving mental health services. Her research has focused on examining the connection between behavioral health disparities and evidence-based practice. Dr. Altschul works closely with tribal communities in New Mexico, and she has developed studies that are culturally competent for behavioral health services. She's been awarded numerous federal grants. I think in 1 year she got like $10 million worth of grants. She's currently the PI on an NIMH-funded study integrating intergenerational cultural knowledge exchange with zero suicide. So thank you, Dr. Altschul, for all your services. Congratulations on your promotion, and please drive carefully. Next, we have also promotion to professor. We have Dr. Artemio Brambilla. Hi, Dr. Brambilla. So Dr. Brambilla came from humble beginnings. His father immigrated to California as a farm worker. At that point, Dr. Brambilla was 18 months old. And Dr. Brambilla's father was one of the first and few Hispanics that was working in the vineyards of Napa Valley, specifically in the Volio vineyards. Dr. Brambilla received his doctorate in clinical psychology from the California School of Professional Psychology in Fresno, and that was in 1989. He completed his predoctoral psychology internship here at UNM in the Division of Child and Adolescent Psychiatry. He was a distinguished student or intern, and fortunately, he stayed here in New Mexico. He was hired as a staff psychologist in 1994, and he was the creator of and the first leader of the partial hospital program. He has taken also the lead in implementing the dialectic behavioral therapy model here at the Child Psychiatric Center. He is a very active teacher in our psychology internship program. And my recollection, Dr. Brambilla, is that you win the Best Instructor Award, if not every year, almost every year, awarded by the psychology intern. So thank you, Dr. Brambilla, for all your services, and congratulations on your promotion. Next, we move to professors with tenure, and we have Dr. Davin Quinn. Hello, Dr. Quinn. So Dr. Quinn completed his undergrad at Princeton, and then he moved to Harvard Med School and MGH, where he completed first medical school, then his residency in psychiatry, and then he completed his fellowship in consultation liaison, again at MGH. Then he made the right move, and he came to UNM, where he has had a distinguished career. He actually founded the Division of Behavioral Health Integration, and he started as a clinician educator, and then he's one of those few who starts as a clinician educator and then moved to a tenure track. And he has been doing studies in TBI. He probably publishes 3 case reports with residents. They have a short rotation with him, but they are able to publish, present the data in numerous scientific meetings. Dr. Quinn also, as mentioned, joined the tenure track, so he has now become a physician scientist. He started another division, that's the neuromodulation division, and he has received over $7 million in federal grants and clinical trials. He collaborates with the VA, and he has received grants from the Department of Defense. He's mentored numbers of medical students, residents, consultation psychiatrists, and we all remember him as Chief of Staff from 2019 to 2021. Then we were very fortunate. We needed a Vice Chair for Adult Clinical Services. He's been doing that job for the last few months, and I think since day 1 or 2, he's been receiving I-Course. There's a few of him. I get messages of the great job that he's doing. Thank you, Dr. Quinn, for your services, and congratulations on your promotion. Then we have a promotion to professor to Dr. Abbott, who is being promoted to professor with tenure. Dr. Abbott completed his medical education at Texas A&M, and then he made the right move. He completed his residency training in psychiatry here at UNM, as well as his fellowship in geriatric psychiatry. Then he continued his research training here at UNM. He completed the Master's in Sciences in Clinical Research Then he became an awardee of the KL2, where he received a Career Development Award, and he also has received funding for training and then for research from the Mind Research Network. Dr. Abbott is the PI of a number of NIMH-funded projects. I would say that Dr. Abbott is if not the global, or if not the national, the global leader in ECT. ECT, of course, at some point had for the wrong reasons, a bad reputation. It's probably the most effective treatment that we have in psychiatry. We provide the only ECT service in the state. And Dr. Abbott actually has contributed worldwide to improve the treatment of ECT, to make it safer and to make it more effective. So we thank you for what you have done for our patients with the use of ECT, to our department, and congratulations for your promotion. Thank you, Dr. Abbott. So with that, congratulations to all the faculty from all of the departments that are being promoted or being awarded tenure. Back to you, Dr. Richards.
Thank you, Dr. Tohen. Next up, I'd like to introduce Dr. Gary Malati, Chair of the Department of Radiology.
Hello there. This is the last one, everybody. So you guys have been waiting 2 hours to congratulate Professor Joanna Fair, who is on here somewhere. There she is. So Dr. Fair is the most amazing person that I know. She is double board certified in both radiology and nuclear medicine. She has been past president of the Southwest chapter of the Society of Nuclear Medicine, which, by the way, is quite the conversation starter when she goes to annual conferences and she says, I'm going to the annual S&M conference. She has been the residency program director for radiology. She has served on the board of directors for the American Board of Medical Specialties. She has served on the board of the American Board of Nuclear Medicine and has served as the secretary, treasurer, vice chair, and chair of the board. She is currently my vice chair of academic affairs, and you all know her as senior associate dean of GME. I am going to share a very brief story of serendipity. So I've known Joanna she knows what I'm going to say too. I've known her for 19 years. And I think she and I both remember when we met. She was a senior medical student at WashU in St. Louis. Her husband was working here in Los Alamos. She was going into internal medicine. She had submitted her applications. She had interviewed, and she did her blow-off elective rotation in radiology here so that she could be near her husband. And she fell in love with radiology and New Mexico, and it was too late for her to submit any applications to radiology anywhere else. But we let her apply here. She submitted her match list of what I think 9 internal medicine programs and 1 radiology program, and the rest is history, and we are better because of it. Congratulations, Joanna.
Thank you.
Thank you, Dr. Malati. You know, I'd like to just say congratulations to all of the faculty members today. This really represents tremendous individual accomplishments. But, you know, I'd also like to just recognize that this is being part of the School of Medicine means being part of a large community in the Health Sciences Center, and that these accomplishments are also attributed to the department chairs who you saw today. And I'd like to extend my thanks to them for all of the work that you've done to help achieve this career development that allowed these individuals to have this success. That was 57 faculty members that we just talked about. There's an additional number of faculty members, about 12 or 13, that weren't here today. So just absolutely incredible accomplishments. So thank you to you and to all of the peers that we have here that have helped make that accomplishment possible. I'd also like to just also acknowledge Dr. Bullard Barrett for the Gold-Headed Cane Award and Dr. Laura Banks for the incredible recognition on the Community Engagement Award. So thank you very much for that service. Thank you, Dr. Wilson, Dr. Siegel, and the Office of Faculty Affairs for all of the incredible work that you've done. And with that, I'll turn this over to Dr. Ziodonis or Dr. Wilson.
Well, thanks, Dr. Richards. You said it so well, so I won't repeat that, but what a great event this was. This was my first here. So impressive, one faculty after another. I also know how much hard work that takes and dedication. And also none of us can do it without great mentors. So I want to thank all the mentors out there who supported all these faculty. No matter how old you get, like me, I still have mentors who help me on the journey. And I encourage all of us to both give back as mentors as well as be open to getting that mentoring. So thank you, everybody, for making this such a great event, and all the family members who joined in, sneaked in, watching on this. So again, need our families' support also in whatever network you have. So I'm happy to say thanks, and can't wait to the next time we do this together and hear all the stories along the way.
Thank you, Dr. Ziodonis. And we are now going to, for those who'd like to stay and just see the pictures of those who got promoted, we're going to run those for a few minutes if you'd like to stay on and enjoy those pictures of all the folks that got promoted with and received tenure today. Thank you so much to everyone, and congratulations.